Ambient scribes are listening in exam rooms. Billing bots are reading explanations of benefits at scale. And inside clinical departments, shadow AI is operating quietly, spun up for specific pilots and left running. Over the last 18 months, healthcare security leaders have poured millions into securing these models. They've built hallucination guardrails, deployed content filters, and layered prompt injection defenses. But the industry has heavily funded AI politeness while leaving AI authorization entirely exposed. A scribe that hallucinates a diagnosis is a safety failure, but a scribe whose service account has unrestricted read access to the entire hospital database when it only needs one encounter, that is a security breach. Securing what an AI says does absolutely nothing to secure what that AI is permitted to touch. We are looking at an unbudgeted blind spot between what AI safety teams are building and what regulators are about to audit. I call this unbudgeted space the authorization gap. This graphic breaks down two silos of AI investment. On the left, AI safety, where organizations focused their money. On the right, AI security. This is the missing infrastructure: identity-bound authorization, continuous enforcement, and audit-grade logs. The OCR Phase 3 audits do not care about prompt injection. As shown in the bottom right, their enforcement focuses strictly on access, identity, and authorization evidence. Two specific forces are about to turn this gap into a crisis: the impending overhaul of the HIPAA Security Rule and a wave of state AI laws that are already active. Treating a responsible, polite AI as a secure AI leaves a health system completely defenseless against these incoming technical audits. The most common objection from healthcare IT leaders is that their core electronic health record system natively handles these permissions. And inside closed systems like Epic, the authorization model is mature, granular, and well understood. The actual vulnerability lies everywhere else: external revenue cycle management agents, prior auth bots, and shadow large language models bypass the core EHR entirely. These third-party tools typically ride on over-permissioned service accounts and flat API keys. They were issued during initial pilot phases to get the tool working and never tightened when the tool moved into production. The technical problem accelerates from there. AI agents dynamically spin up sub-identities and execute action chains much faster than security teams can track them. These automated actors function as non-human identities, operating completely outside the traditional human workforce perimeter. Every prompt that triggers an AI action chain becomes an unlogged authorization decision happening beyond the EHR's protection. The proposed HIPAA Notice of Proposed Rulemaking mandates a massive shift: the elimination of flexible, addressable compliance controls. The enforcement standard is shifting away from policy-based documentation in a binder to continuous, live technical evidence in the form of logs. This table outlines the proposed HIPAA controls and where traditional identity stacks break down under AI agents. Notice the second row's high difficulty level for maintaining a written asset inventory and network map of every asset touching protected health information. It is virtually impossible to manually maintain a live inventory of every non-human identity or agent interacting with that data. Moving down the table, we see the proposed requirement for 1-hour workforce access termination. Legacy identity providers fail at executing sub-hour deprovisioning at the specific API access decision level where these bots operate. Finally, look at the second to last row: the requirement for business associates to provide written verification of technical controls. Passing this verification requires vendor API connections to generate audit-grade decision logs that can be shared across network boundaries. The old rules asked for policies. The new rules demand exact, machine-readable proof that current AI infrastructure cannot provide. While federal regulations are still pending finalization, state AI laws present an immediate enforceable threat. This timeline tracks the convergence of these deadlines. The top track compresses the deployment window significantly. Focusing on September 2025, Texas Senate Bill 1188 mandates that a practitioner must personally review all AI-generated content before making a clinical decision. Similarly, California Assembly Bill 489 prohibits AI systems from implying healthcare licensure. Complying with this means any patient-facing AI must carry provable identity and scope context. These state laws carry severe civil penalties, reaching up to hundreds of thousands of dollars per violation, plus daily fines. If a prior auth bot executes an action without a logged, authenticated clinician review, the hospital violates state law and federal audit trail requirements simultaneously. The compliance gap is already here. Surviving these audits requires an architectural shift away from static permissions and toward policy as code. Returning to our authorization gap diagram, the right-hand column outlines the necessary target architecture. The foundation is identity-bound authorization. Every single AI agent and service account must be treated as a first-class identity, receiving the exact same scrutiny as human staff. This means enforcing permissions at runtime, at the exact moment of the API call, rather than relying on periodic access reviews. Every AI action executed against protected health information must generate a readable, audit-grade decision log. Only continuous, identity-bound enforcement can close the gap between rapid AI adoption and these strict regulatory evidence requirements. Looking closely at the federal timeline, once the final HIPAA rule is published, health systems have a narrow 240-day window to comply. For security leaders, the first immediate directive is to execute a ruthless inventory of your entire AI footprint, sanction tools, active pilots, and shadow systems. Map every identified AI agent to the specific health information it touches and the precise API identities it uses. Second, isolate your single highest-risk workflow, such as ambient scribes, and run a simulated NPRM audit against it. Ask your team if they can produce exact evidence of authorization for every single API call within that specific workflow. Third, force the conversation with your business associates immediately regarding the written verification of their technical controls. Vendors who cannot provide audit-grade decision logs for their non-human identities will not survive upcoming procurement renegotiations. Polite AI got healthcare through the experimental pilot phase, but only secure, identity-bound AI will survive the coming 240-day regulatory window.